Okay. Hi, Tali. Thank you so much for joining us for one of our spotlight interviews. I'm super excited to talk to you, and I'm super excited for everyone to hear how amazing and cool you are and hear more about your journey in medicine. Um, so I guess just to start,
Oh no, I can't hear you.
oh, you can't hear me?
Oh, you're back now. You're
Okay,
back.
I'm back.
Okay.
Okay, cool. Sorry.
That's okay.
um, I guess just to start, what did you major in undergrad, and how did you decide on that major?
Yeah, I majored in human biology from the start. I thought I was going to do human biology. I really liked science. Actually thought I was going to do the PhD route. So I was really interested in cancer research, and kind of loved the biology. And then it was my not until my junior year when I was actually doing research with the MD PhD, who kind of changed my mind to go the MD route. I'm very glad she did, but it was a longer path for me than some. But I loved human biology. I love the flexibility that you can have in your kind of second and third or third and fourth year, to kind of choose different classes. So that was a good fit for me.
Yeah, that sounds amazing. What um like what did this MD PhD do to like change your mind? Like
Yeah.
how'd you decide like maybe not the PhD, maybe let's do the MD?
Yeah, first of all, she's just an amazing mentor. Dr. Teresa Prisner, not she's not at Stanford anymore, but I would not be here without her for sure. And yeah, so basically, the first time I met with her, she was doing neurobiology, developmental biology research. And she said, the first time I met her, she was like, "You're going to want to go to med school. You just don't know it yet." And I said, "No, those people are crazy. Like, that's not for me." She said, "Okay, okay." And I really looked up to her. So eventually I was like, you know what, I should consider it. I really like her. I like her approach to, how she thinks. She was, super smart, energetic. And I was like, okay, if I can be a fraction, of how she is, that would be awesome. And so I started looking into it. I actually interviewed, like 10 to 15 different physicians, kind of like who had gone through the Stanford pipeline. Ames didn't exist at the time. So you guys have a leg up on that, to kind of decide that that's what I wanted to do. And then after that, I kind of was on the train late, but got there eventually.
Yeah, so you decided in your junior year, um, like what steps did you take as like
Yeah.
deciding to be pre-med in your junior year?
Yeah, so I was doing home bio, so I had all the biology, all set there. But yeah, it was the end of my junior year, so I hadn't done any physics. I'd only done like one intro chemistry, hadn't done like organic chemistry. So there was a lot to do. So I decided to do like a co-term, and stay and keep doing that research because I really enjoyed that. And then kind of like along with the co-term, I could like add on like organic chemistry and all those other classes like physics that you need to do. So I kind of just like squeeze them in when I could, which kind of meant I was off track, like not doing the classes with my class, which I actually kind of liked. I found it less competitive. So it worked, it all worked out.
Mhm. Yeah, and so when did you like start studying for the MCAT, and like what did that sort of prep look like for you?
Yeah, I don't remember when I started studying. I took it at some point when I was doing the bio masters. So I did kind of 2 years or a year and a half to do that.
Mhm.
So I did a little bit longer to do all the extra pre-med classes, and I was also doing the research. So kind of during that time, I studied for the MCAT. I did like some prep course, like it was like a nighttime prep course, and just did a lot of practice tests. But yeah, I think I've kind of blacked that out of my memory a little bit.
Wanted to forget that. Yeah. Were there any other like experiences that you had in undergrad that you think were super formative to your journey into medicine?
Yeah, I did that Camp Kesem, which I absolutely loved. Highly recommend that, you guys look into doing Camp Kesem. If you don't know, it's a camp run by Stanford students, for kids whose parents have or have had cancer. And that was a great experience. You just get to really know these families and these kids. And throughout the year, you plan the whole camp, and then you work there the first week of the summer. So I did that for several years, and it's completely fundraised for by the Stanford students as well. So got pretty involved in that, which I really enjoyed. So I did that. Yeah, I was on the sailing team, so and school, so that's kind of the most of it.
Mhm. Yeah. How did you feel? Like, how was balancing all of that for you? Because I can imagine like adding a whole new career path late while also balancing athletics is probably a challenge.
Yeah, it definitely was a challenge. You know, it honestly, I would never call med school easy, but going to med school and then being back and like, you know, as a full-time student and not being a varsity athlete, it felt so much easier, you know, instead of, you know, having 6 a.m. workout and then practice for, you know, 5 hours in the afternoon and then traveling on weekends. I was like, oh, I can, you know, just go on a short run and then study. And, you know, it suddenly, you know, felt easy compared to undergrad. So I think being a Stanford student athlete and also pre-med sets you up really well to really succeed in medical school, because you have to learn how to, you know, study for that test on the flight back from competition. You know, you miss all the office hours because you're at practice. So you have to kind of learn how to teach yourself, which is a really valuable skill in medical school and obviously beyond. So yeah, I think it sets you up really well. It was really hard, but Stanford's a great place. I had fun. Like I liked it, liked
Mhm.
sailing and liked my major. So it worked out.
Yeah. Um, would you say like, so it being a student athlete like set you up really well in terms of study skills and stuff. Are there any other ways that you feel like being an athlete has served you as you continue um in your journey in medicine?
Oh my gosh, so many ways. I would not be the person I was today if it weren't for doing varsity athletics in college. You know, definitely it's the study skills because you have to study on the go, but it's much more than that. You know, medicine, especially once you get through med school into, you know, residency and beyond, is really a team sport. Whether that's you know, with the residents and interns and medical students that you work with to care for patients. Um, or, you know, just the team of you know, interdisciplinary healthcare workers that you work with, like the nurses, social workers, physical therapy. You know, you're always working with all these different people, and I think that experience of being on a team and having a common goal really translates to medicine.
That's that's great to hear. I feel like a lot of people will, because in the moment this is like hard, but knowing that there's like these like great things that pay off down the road and carry on, it's great. So then, okay, so you did your co-term. Where did you go to med school?
I went to med school at UCSD, UC San Diego, and I stayed here for residency as well. As you can see my surfboard
Mhm.
collection.
Yeah, how did you like med school? Can you tell us
Oh,
more about your
I love med school. It was great. I know that's not probably a common answer. But yeah, the first 2 years, you're mainly in the classroom, just learning all this stuff that I thought was interesting. So I really enjoyed that. You're kind of studying with friends. And then third year, it gets much harder. You know, you're at least at UCSD, you're, you know, in the hospital all the time, but you're finally getting to do what you've been studying for so long. And then fourth, you really get to decide, you know, what you want to go into. So yeah, it's a long, but I loved it. Obviously I love San Diego. And in med school, like you'll learn a lot, but you also make amazing friendships. You'll meet amazing mentors. It's a really cool process.
That sounds great. What was like, if you had any like tips or tricks, like what do you think, what would you have like told like younger you before,
Yeah.
I guess before undergrad and before also med school?
Yeah, I mean, younger me before undergrad, I'm not even sure what I was thinking. So I'll direct it to, you know, like in undergrad, is that, you know, each step of the way, it's so easy to think, you know, okay, I just have to work hard to get into med school, or once I'm in med school, I just need to work really hard to get a good step score to get into that residency program. And then in residency, it's the fellowship attending job, and it never really ends. And so I think one thing I was really intentional about going into medicine is, you know, I didn't want that to be how I thought about my life. You know, I wanted to enjoy every step of the way, especially in medical training. It's so long. So I'd say really focus on, instead of like, you know, looking just towards the next step, because then there's going to be another step, just really enjoying what you're doing in the moment, and making the most of that. Rather than waiting until some certain step to live your life, because, you know, it doesn't happen. And not to say that, you know, that's a bad thing. I think it's a good thing. It's liberating to feel like, oh, I can live my life now. And, you know, I don't have to wait until I'm into med school or into residency or, you know, whatever.
Mhm. Was there a time that you feel that was put to the test the most, like when looking at the next step became very difficult, and like how did you overcome that?
Yeah, I think, you know, intern year, I know a lot of people probably answer that. It's just, so intern year is the first year of residency. It's just really hard. You work really long hours, you don't sleep a lot, and it's a really big learning curve too. So, you know, you're really thrown in. There's a lot that you need to learn really quickly. So I think that was hard because, the amount of time that you have to do the other things that you enjoy is just much more limited. So advice I got kind of in the middle of intern year was, okay, yeah, you used to, go to yoga or run, whatever you like to do, every single day. It's really important not to stop completely, even if you're doing it once or twice a week. That's so much better than completely stopping. So I think just being intentional about what you're doing, and what those things are that make you happy, but not to scare anyone. It gets better.
Mhm.
I'm a second year now, and it's much better than intern year. So yeah, you'll get through it.
Yeah. How did you choose your specialty? Like, what led you to internal medicine?
Yeah, so that was also kind of a not straight path. Going into med school, I thought I wanted to do surgery. I was thinking about, orthopedic surgery. I was like, oh, I'm an athlete. I like fixing things. And, I got into the OR, long hours in the OR, and I was like, oh, this is not for me. I miss talking to patients. I miss like thinking about what they had. I love internal medicine because you really get to problem solve, and at lots of different complicated problems all at once. So I like the physiology. I like the patient interaction. You get to do a lot of different things. So yeah, I really like that. Thinking about doing a fellowship in cardiology, which is kind of, like it for a lot of those same reasons. Really interesting physiology, great patient population. There's a lot we can do to help patients in cardiology. So yeah, there's definitely a lot to learn about different specialties, and much more than I initially thought going into med school. There's a lot of different options.
Yeah. If you had any advice for somebody that's like going into a process where you're like making choices, what would you?
Yeah, I would say just talk to as many people as you can at different stages in the process. So, for example, if you're trying to decide, you're in med school trying to decide what specialty to go into, talk to a resident, but also talk to an attending who's been attending for 5 years, who's been attending for 30 years. They're going to have very different perspectives. Don't just talk to the, resident who's burnt out and tired. And, you might talk to the attending and they might say, this is the best thing ever. So just get a range of perspectives, and I'd say stay curious, and you might end up loving something that you never considered. That was my case. So don't mentally close yourself off to anything.
Mhm. That's great advice. Um, it's a little bit more of a jump, but what would you say is like the toughest thing that you've experienced so far? I know we've talked about a few challenges so far, but and like how you got through that in medicine specifically.
Yeah, that's hard. I mean, intern year was really hard, obviously. I think third year is hard for different reasons. Third year of medical school, that's hard because you're kind of thrown into every different specialty. You're working really long hours and you don't really know what's expected of you. And you're not yet at the level where you are, know much to contribute, so you're just trying to learn, and you're trying to figure out where you fit in the team. And that's a hard spot because it's kind of like you're being, you're back to the bottom of the totem pole. So it's both humbling, and also exciting because there's a lot to learn. But I think that's a hard process because you do, 3 months in one specialty like surgery, and then you do 3 months in obstetrics and gynecology. And then as soon as you have one thing figured out, you're jumping on to the next thing. So I think that was hard. How did I kind of get through it? I think just really relying on friends and family. So, it might not be, a whole weekend away with friends, but if I could call, like a friend on my drive home from work, just kind of talk about what happened, or, just make sure that you're staying in touch with the people that care about you. I think that's
Mhm.
kind of a way to get through those hard times. But there's a lot of really good times as well.
Yeah. On a lighter note, what do you think has been your favorite thing so far about your journey?
That's hard. There's been so many good things.
You can list a few.
I think one of them was, I talked about my mentor in undergrad was Dr. Persner. So I worked with her doing research, and she was amazing. Like she, really got me interested in medicine when I hadn't even considered it. So I'm very grateful to her. She's very excited, energetic, someone, I'd like to emulate. So I think that was really awesome, finding this whole career I had really kind of just ruled out. And then I'd say residencies. So I'm in my second year of internal medicine residency. I think residency has been really incredible because you're finally getting to do what you've trained so hard to do. And, your patients call you doctor, you're their doctor. And, going through the first year, at the beginning, you feel, overwhelmed. And then at the end of the year, you can look back and say, oh yeah, I know how to handle that, sick patient, or I know how to talk to that patient's family about what's going on. So I think that's a very rewarding process as well.
Mm-hmm. Sounds incredible. Back to the research thing that you were doing in undergrad. How did you like go about finding finding these research things and like figuring out what you wanted to do? And do you have like any advice for an undergrad when it feels like there's a lot that you could choose to do in undergrad?
Yeah, there's, Stanford's, you're very lucky to be at a place where your problem is not too little research opportunities, too many, so what do you choose? So I just talked to different mentors. So, that was in the Scott lab at the time. So I met with Dr. Scott, who said, I have this, person working in the lab, Dr. Prisner, who's amazing. I think you guys would get along. And then I met with her, kind of talked with her, and then found that to be a good match. But I would just recommend talking to different people. And then with the project, I'd be very specific about, what you're looking to get out of it. Whether it be lab skills, whether it be a publication, and then what are those steps? So I'd say, be wary if it's a vague, not well-defined project, and also be wary if it's too big of a project that, is just not going to be reasonable to finish in the amount of time. You're a busy undergrad who's also doing a sport. You're not going to have time to take on like a PhD level project. So it's so much better to take on a smaller project and be successful. And then, if you finish that easily, you can always do more.
Did you do any other like shadowing or other things to help you prepare your application? And like, how did you go about accessing those?
Yeah, I did a little bit of shadowing. I remember shadowing OB-GYN, watching some babies get delivered, which was really cool, as like a senior, I think. I don't really remember how I found them. I found these people to shadow. Sorry.
Yeah, I think we're starting a new AIMS, and we're like Sims shadowing. We're trying to like initiate that hopefully, but
yeah, that's great. Yeah, I mean, I know most people, most physicians, residents, physicians are happy to be shadowed. It's more just kind of reaching out.
Mm-hmm. Yeah. What was I going to ask you next? Oh, how do you feel like you can most help undergrads for mentoring? Because, we're going to encourage people to talk to you. And so like, what do you feel like you most want to help people talk to?
Absolutely. Yeah. Definitely happy to talk to people if they're trying to decide if medicine is right for them. If that's something, non-judgmental. I know it can be scary to say, oh, I'm not sure I want to do this. I'm happy to answer your questions about that. Also happy to talk about different specialties, how you choose what specialty to go into. And then a particular passion of mine is continuing to live your life through medical training, at times more successfully than others, times less, but continuing to do the things that are important to you. It's a long path. And I think it's very important to have that front and center. So happy to talk about that as well.
Mm-hmm. Awesome. Is there anything I missed that you want to talk about or add? Not sure.
Yeah, I think one thing that I didn't know and I was very nervous about kind of applying to med school is, it's like, I'm a bad applicant, I didn't have perfect grades. I hadn't done all the typical pre-med things. I know it sounds like, oh yeah, I had all this research put together, but I really like started all that pretty late, like junior, senior year. I had like 1 C+ in like Cum Biocore. I was like, they're for sure not going to accept me. And I was really worried that I hadn't checked all the boxes or I wasn't that like perfect applicant. And I would say one thing to really, don't let yourself think that way. You're exceptional. You're at Stanford, you're a student athlete. Just being an athlete at Stanford, you have, that is so much work. So I wouldn't devalue that. And I would focus on doing things that you're passionate about, just because you think, oh, I need to check this research box, to get into med school, find something that, you like doing. Don't do something just because you feel like you have to. It'll be very clear if you enjoy something or not. And, I'm sure you'll be able to find something that you enjoy doing. So I would say like, follow your passions. Yes, there's going to be some things that you just have to do. But the more that you can choose to do things that you're excited about, the happier that you're going to be.
Mm-hmm. Also, I just forgot to ask this. I realized I didn't ask, but like, what are you looking forward to the most now? Like, obviously we have so many more years ahead of us, but like, what do you see your next steps as, or like what you're most excited about going forward?
Yeah, I mentioned this earlier, but I'm pretty excited about cardiology. It's also not something I thought about until intern year, but I just think it's a fascinating field, and there's so many different ways to help patients, and it's constantly improving and changing. So I'm really excited to learn more about that. Hopefully, I get to do fellowship in that. Um, and yeah, I think, medicine's cool. Like really have to be a lifelong learner, and I love that about it. You're never done learning, and there's always cool new things coming out. So I think that's something that keeps me excited about medicine, is that I constantly get to keep learning new things.
That sounds incredible. Yeah. Thank you. Thank you so much for talking. You gave such great advice across the board about your journey. And I'm really excited for everyone to get to hear about you and hopefully talk to you during your Spotlight Week. Thank you so much.
Awesome. Thank you, Ava.